Hi, I'm Jeffrey Sather. I'm the Chief of Staff at Trinity Health in Minot, as well as an emergency physician. Well, as Chief of Staff of our health system, we have about 300 medical providers, and we're the referral system for our region and the state. What we recommend to all the providers in our region is to be hooked up to NDHIN, because our system is live with NDHIN. So it's as simple as I'm in the patient's record, clicking that NDHIN tab takes me right into the NDHIN record for that patient. Well, I saw a patient just the last shift I worked who had been seen in another hospital with a hospitalization a couple days prior. And in hearing that from this child's mom and hearing that he'd had multiple tests, it was important for me to be able to get those quickly. This was actually a very sick child that waiting for records would have been a detriment, and not having records of the test done there would have forced me to duplicate some testing, which is not only not good for the child, it's not good for the financial side and delays and exposure to radiation and tests. So I was able, within a couple of clicks, be able to get into the NDHIN, look at not only the reports from radiology studies that were done, but actually see the actual images. I also was able to look at admit notes and discharge summary and treatment that was done in the other facility, which really expedited my care for this patient.
I'm Joelle Goldaddy. I'm the Director of Clinical Operations for CHI Health at Home. In the past, when our clinicians, both nurses and physical therapists, occupational therapists, needed to have information about their clients, what they used to do was have to call the medical record department of the hospital or the clinic, and they'd have to wait a week or so before they got their medical records. And we're having to rely on the expertise of the clients that we see in the home, that oftentimes that information was inaccurate. So we were relying on our clients as opposed to the accurate medical records from the provider. So currently in NDHIN, which they have been absolutely wonderful, we're able to onboard all of our clinicians to get access to NDHIN. Not only the nurses and the physical therapists and the occupational therapists who see those patients in the home, but the administrative assistants who are able to access that medical record in real time. They can get those medical records and know what's going on for those clients and have an understanding of what their medication changes were. Most patients often see, that we see it in home health, are seeing 5, 6 providers. They might see a provider from the VA, they might see a specialist from a clinic, and then see their primary provider. And we see fragmented care. Often those different aspects of care, they're not talking to each other. And with home health nurses, we come into the home, we pull that data from NDHIN so that we can see what accurate information and align those medications between all those silos of care and try to streamline it for our patients in the home setting. That, to me, is one of the best reasons to have NDHIN, is to be able to have accurate, readable information. That it's not like 1979 when I started working and we were trying to read a foreign language written by physicians.
A lot of times you had to get a release of information, get it faxed. When you didn't hear back, you had to fax multiple times to get the same information, and then it sometimes took weeks or months to get that information. And so now, of course, we are able to look and see some of those records through the record sharing.
Nowadays, so much is performance-based. Lowering the cost and patient satisfaction and quality. And so North Dakota NDHIN is part of all of those.
Emergency situations are a great example. Someone's coming into your facility, you don't know, maybe you have a name and birth date. Now you have access to their medical record quick and easily. Labs, x-rays, past medical, recent fills, whether it may be an overdose, not an overdose, diabetic, emergency, hypertension emergency, you have all that information at the tip of your hands from other providers. So getting that information could be critical at the time for the patient.
I just know it's helpful, especially with, there are some facilities that provide some mental health visits that I'm usually very careful about what I may access. But it's helpful in my line of work, especially if somebody's coming in and we do some type of assessment here, a quick assessment. We find out they might be somewhat suicidal, and I can take a look at that information and say, hey, what kind of history does this person have? So I can make a really important judgment on whether that person can follow up with just a basic safety plan versus getting to the ER because they're on that cusp of potentially going to harm themselves. It really is a valuable service. It makes so much sense.